Okay, students, as we've already started with a new chapter, that is Introduction to Public Health. And we've seen some introductory part of it, that is what is health, what is operational definition of health, what exactly is public health, what is the difference between a normal clinician and a person who is an epidemiologist who work for the community, right? And then we've come for concepts of causation. That means why the disease is there. There are, say, several concepts which will say that what are the factors responsible for that particular disease. So in that also we've studied about epidemiological triad. I'll be just starting with introduction of that epidemiological triad and then we can go forward. Okay, so the epidemiological triad, as we've already seen, and as the meaning of the triad, it has three parts. Three parts, that is agent, environment, and host. So what do you mean by agent here is, agent is the person or the environment or anything living or non-living thing, the presence or absence of which may lead to a disease. That is called as agent. Second is environment. So environment is the area or the environment which will allow that agent to come into contact with the host and interact with the host to cause some problem to the host. So that is the environment. So we call it as conducive environment, which will lead to a disease formation in host. And third will be your host, means the person or the tissue or the body part which harbors that particular disease, which is suffering from that particular disease, and because of which it is not being able to live their normal life or normal function is missing because of that particular thing. Okay, so this is the epidemiological triad. Now we have an example of epidemiological triad of periodontitis. So what you can see here is pathogenetic bacteria which are acting as agent, like various bacteria. Can you just name some of the bacteria, like anything which starts with the plaque, so streptococcus mutans, and mainly the lactobacilli which work into that anaerobic environment to make that disease happen. So these are the agent factor. Then the environmental factor, like patient is not keeping his oral hygiene properly. Second thing, maybe patient is having some systematic disease like diabetes, which is predisposing him for certain kind of a diseases, certain kind of a periodontal diseases. So that is an environmental factor. And the genetic factor into that person is that person, by virtue of their genetic, they are predilecting towards that disease. That means they're having that disease in more amount as compared to other people. So these are the agent, environment, and the host factor for causation of periodontal disease. So until unless all these three they work in tandem, all these three they work in tandem. So any of it, if any of it is missing, the disease won't happen. So why we need to learn the concept of causation is, once you know why the disease is happening, then you can just stop or prevent that disease from happening with the use of this triangle. So if you know the pathogenic bacteria are causing the disease, so you can just limit the appearance of pathogenic bacteria by scaling and polishing. Second thing, by keeping good oral hygiene, right? Then the environmental factor, again, the hygiene comes here. Then systemic diseases, you can have some medication so that you can prevent appearance of that particular bacteria into mouth. And genetic factor, which is actually a non-modifiable factor. So about two factors, if you can control, there will be absolutely no periodontal disease, or the amount of periodontal disease for that particular person can be limited. So that's why we need to learn this. If any of these three angles is broken, the disease won't happen. So as you can see, there are three circles where in the center you can see the severity of the periodontal disease. Until unless these three sectors they coincide with each other, there is no disease. So where one or two sectors are they're getting together, we cannot see any disease over there. Whereas all the three circles, wherever there is a concentric part of it, there only we can have that disease. Okay. Now, the second concept is epidemiological tetrad. Okay. Now, what do you mean by epidemiological tetrad? As we have tried, now we have tetrad. That means there are four things which are of importance. There are four things which is of importance. So tetrad means four parts. Now one more thing has been added, that is time. That means we need to give time for these host, agent and environment to act together. To act together so that there will be ultimately the disease. So even if you keep these agent, host and environment in one single place, but you do not give them time to interact with each other, there won't be any disease. That is the meaning of epidemiological tetrad. So here you can see a tetrad which is made for dental caries. So you can see plaque organism which are being agent here. Then the substrate, that means the food which is accumulated around your tooth, that becomes the environment which will give them the environment. The time factor which is needed, because caries is not one fortnight or overnight thing. So you need to give them time to interact, and the susceptible tooth means the tooth that is not being taken care of, or the crowded tooth where your bristles cannot go. Okay, so such kind of a teeth, they are more susceptible for dental caries. So all these factor, that is the host factor of the tooth, all these factor in tandem, if they stay in uh, the particular environment for over a period of time, then only you can have the caries. So all these four circles, if they interact with each other, then only you will be having the caries. If any of the circle, if you can break it, then there won't be any caries for your patient. That's why you have to concentrate your efforts in breaking these circles so that there will be prevention of caries in future. So we've again seen in detail what is agent, what is host, what is environment. So agent is an organism, a substance or a force, the presence or lack of which may initiate a disease process or may cause it to continue. So it is the person or the organism or the substance, made living, made non-living, may be a nutrient, whether the presence of it or excess of it or lack of it may cause some disease to your body. So that is the agent. Then the host is the second perspective. That is, host is a person or an animal or a tissue or an organ that affords subsistence or lodgement to an infectious agent under natural condition. So the host has that body in which the agent stays and interacts. That's why there is a disease. So there are various factors, the host factors, which are responsible, like demographic factor that we have already seen right now in periodontal diseases, where the genetic factor was working on, biological factors, socioeconomic characteristics, and the lifestyle, that means the habit of that particular person. Now, the third is the environment, that is the source or reservoir for the agent of the disease. So, there are, as it is, there are agents into our environment everywhere. Then we are the host, but there is no proper conducive environment. Then there won't be any disease. So, the environment has to be conducive to cause the disease by the agent to the host. So, environment can be again divided into two parts, that is internal environment and external environment. I've already told you that internal environment means anything below your skin. Anything which is below your skin is your internal environment. May it the amount of iron that you have, the amount of cholesterol that you have, the amount of tissue you have, fat, or whatever things that you have, the blood you have, everything is your internal environment. Whereas external environment is anything which is outside your skin. Anything that is outside your skin is your external environment. So even your clothes, they are your external environment. If you're wearing neat and clean clothes, there will be less amount of infection to you. But if you're wearing soiled clothes, there will be some amount of infection to you, right? Because there are high bacteria laden on those unwashed or unhygienic clothes. So that is your external exam. There are some classification of environment, like physical environment, for example, temperature, for pressure at that particular area, moisture at that particular area. Then biological environment, like how many amount of bacteria or plants or any kind of allergy causing, what do you say, animals, they're there. And socioeconomic environment for that particular person. So this is about epidemiological triangle. Now the next concept is concept of causation, that is multifactorial causation of Betancourt of Munich. So what he is saying is, he's saying there is no direct formula like ABC. There is no direct formula like ABC. For there is no only one risk factor which is responsible for a disease. For a disease to happen, what he has to say is there are multiple factors which are acting in tandem, which are acting all together to cause that particular disease. For example, there will be one disease, there will be multiple agents like agent 1, agent 2, agent 3, which are there into the environment with the susceptible host for a period of time, so that ultimately you will have a disease. So there is no only one agent, but multiple agents or multiple factors which are getting into that particular environment. For example, now I can tell you that when you see patients who are having any tobacco related habit, now you know that all patients who are having tobacco related habit, they do not have lesion all the time. Are you agreeing with me? Right? But there are few people who are having tobacco related habit and they've just started chewing tobacco. Still they have some amount of lesion into their mouth. So why this is so? This is because there are multifactorial causation theory. Okay, so the person who is chewing on tobacco, he might have some other factors also. For example, genetic factors. He may be predilected to oral cancers. Second thing, he might be having some other habits along with it, like alcohol. Then third factor may be because of he's having some ragged border of his teeth which are continuously impinging on his tongue. That is one of the irritating factor, and alcohol and cigarette, they are another irritating factor for his tongue. That's why he has developed the disease. So like this, multiple factors are there and they're working in tandem to cause that particular disease. That is the explanation of multifactorial causation by Betancourt of Munich. Then the next concept is about natural history of disease. Okay, natural history of disease. Now, what do you mean by natural history of disease and why we need to learn it? So, natural history of disease means once the person is in contact with that particular agent in that particular environment, you need to see what exactly is happening to that particular person. You need to see what exactly is happening to that particular person. So what will you just need to observe. You need not have to disturb them. So there, that particular, the entire time when the person is in contact with the agent and the agent is causing him some disease, it will be divided into two parts, that is period of pre-pathogenesis and period of pathogenesis. So first phase is period of pre-pathogenesis. What do you mean by this? Means the agent and the host, they are into the same environment, but the agent has not still started giving some pains to the host, or the agent has not started causing the disease to the host. They are just into the environment and they are just alongside and they are getting along well, but there is no disease, but they are into that, the risk factor is present into that particular environment. So that is your period of pre-pathogenesis. Once the agent enters into the host, that is called as period of pathogenesis. So once the agent enter into the host, then it takes some time, that is the incubation period. It multiplies, it utilizes some things from the host body, and there will be some byproducts because of which the host may have some disease. So these are the two different phases of natural history of disease. Now, why we need to learn all this? Okay, so if you know the complete natural history of disease, that means from where the disease has started, what is the agent, how much time that agent needs to interact with that particular host, how it enters the body of the host, and how it multiplies, and ultimately what kind of a disease it causes, and what is the prognosis of the disease. You can plan your prevention according, right? If you first of all, if you know that this is the person, this is the agent which is giving that disease, you can all the way eliminate that complete agent. If you cannot eliminate that agent, you can make host body more immune towards that agent. Second thing. Third thing, what you can do, if the agent has already entered into body of the host, you can stop it, its multiplication into it. And fourth thing, if there is a disease by that agent, you need, you will be coming to know how to kill that agent or stop that agent from causing that particular disease and more deformity into that host body. Okay, so that's why we need to know why there is, what is the natural history of that particular disease, to know where to stop that disease and what to do about that disease. Okay, now this is an example of web of causation in, I've given you an example of oral cancer. Now this is another example of dental caries, where you can see there is a dietary sugar and dental plaque, which will ultimately lead to acid, and this acid will be there on the dental tissue which are overcrowded or where the bristles are not reaching. That's why there are dental caries. There is another example, that is of dental erosion, where the dietary acid and reflux disease in tandem, they are working to widespread dental tissue dissolution, and ultimately you'll have dental erosion. So the web of causation says that there is no only one factor, but there are multiple factors which are working in together to cause that particular disease. So if you can break off any of the arms, if you can break off or stop off any of the arms, there will be less amount of disease or there won't be any disease. So that's why you need to know how this web works. Okay. So the next concept is about risk factors and risk groups. Now, what do you mean by risk factor? It is attribute or exposure that is significantly associated with the disease. So, risk factor is significantly in every time it is associated with the disease. For example, we take example of dental plaque. Until unless there is dental plaque, there is no dental caries or periodontal disease that can happen. So, dental plaque is a risk factor for developing of dental caries and periodontal disease. Determinant that can be modified by intervention, thereby reducing the possibility of occurrence of disease or other specified outcome. So it is a determinant that can modify by intervention, uh, that can be modified by intervention, like mechanical cleaning, thereby reducing the possibility of occurrence of the disease and other specified outcome. So once you mechanically clean the dental plaque every 12 hours, that is morning and the evening, there are less amount of disease, then it is suggestive of that particular disease. So if you can find out more amount of dental plaque in somebody's mouth or more amount of calculus in somebody's mouth, you can definitely say yes, this person may have more amount of dental disease, specifically periodontal disease into their mouth. Then observable or identifiable, you can observe these changes into patient's mouth easily. Multiple risk factors have additive or synergistic effect. So dental plaque along with the calculus, it is more detrimental for periodontal diseases health as compared to only dental plaque. So they have synergistic or additive effect. That means they can increase the process of patient falling ill for that particular disease. Okay. Then causative or contributory, it may be causative or contributive factor. Risk factor may not be every time causative factor, it may be contributive. For example, calculus. Calculus is not the reason for periodontal disease, but the plaque is. But it contributes by giving a surface where the plaque can attach. So it is a contributory factor, not a causative factor. Whereas dental plaque is actually a causative factor for periodontal disease. Okay. Then modifiable or non-modifiable. So plaque can be modified as in that can be removed from patient's mouth, but the age of the patient, the immunity of the patient, the genetic susceptibility of the patient, those things cannot be modified. So these are the non-modifiable factor with which you have to go forward, and you have to look for other factors which you can modify or remove from patient's mouth so that there will be less amount of disease. Now, this is all about risk factor, which can be a short note to you, but what are the risk groups? Various risk groups. Exposed to risk factor, they are more exposed to risk factor. For example, if you take example of radiologist, okay, they're continuously being exposed to radiation as compared to other population. So this is the uh, group, special risk group, where you can have more problems related to exposure to radiation as compared to other groups of doctors. So these are the special risk groups. Or another example is pregnant women. So by virtue of their pregnancy, they have some hormonal changes because of which they are more susceptible to gingival diseases as compared to other women. So these are the risk groups where you can find out more gingival inflammation as compared to other groups. Okay. Epidemiological methods are required to identify risk factors and risk groups. Why so now? Because risk factor, if you identify, if you eliminate these risk factors, the amount of disease or the burden of disease that you can find in community, that can be lessened, and it is always easy to prevent a disease than a cure of the disease. Cure is always more tasking, it is more painstaking, and it is more expensive as compared to prevention. So as soon as you know that these are the risk factor for this particular problem or this particular disease, you think about preventing or prevention of that particular risk factor only from happening. Okay. And about the risk groups, once you know that this particular group is susceptible for that particular disease, you can concentrate your efforts more onto that group so that the major chunk of the disease can be eliminated. Okay. Now the next concept is about risk approach. Risk approach. So, it approach developed by WHO to identify risk groups in the population by certain defined criteria. So, as I told you, if you concentrate your effort more towards the risk groups, then there will be in less efforts you can eliminate major chunk or major amount of the disease. So, how do you find out these groups? With the help of risk approach, something for all, but more for those in need in proportion to the needs. So this is the principle behind the risk approach, where we do something for all. But as we know, the risk groups are more susceptible for that particular disease. We are doing more for that particular group. Okay. For increasing efficiency of the health system, and we do not want to waste our resources, which are very difficult to get. That's why we are going towards more a risk approach than mass approach. Okay, mass approach means we are treating or we're considering everywhere. Whereas in risk approach, we actually target a special group or the risk group and we concentrate our efforts there. Now, next concept is about spectrum of disease. So, as we have spectrum of health, if you remember last time we've discussed in our last lecture, there is a spectrum of health. So, the lower part of your spectrum of health, we can go behind just to understand that part. Just a second. So can you just see this spectrum of health? So we've already learned that it is a continuum, it's a dynamic phenomenon and health keeps on changing. There is no continuous part of it. So lower part of spectrum of health, lower part of spectrum of health, which you can see here, is known as spectrum of disease. That means disease is again is on continuum and it keeps on changing. It do not have the same status all the time. It do not have same status all the time. So the best that you can do is from disease is unrecognized disease, whereas the worst that can happen to you because of that disease is death. Okay, so this is the spectrum of disease that we can see here. So again, it says subclinical infection where the disease cannot be recognized or the patient is having carrier state where the patient is not being uh, traumatized by the disease of that particular disease, but he's having that particular disease into his body, and towards the fatal illness where the patient might die of that particular disease. So that is the spectrum of disease. Then the next concept is concept of causation. Last concept of causation is your iceberg phenomenon. Okay, so what do you mean by iceberg? Have anybody has seen iceberg ever? So what do you mean by what is the quality of the iceberg? So as you know that when you see iceberg, there is only 1/20th part of that iceberg that we can see, or one third or one fourth part we can see on the surface of the water, whereas all other amount of iceberg has been submerged into the water. So by just looking at your tip, which is visible only on the water, you cannot understand how much amount of iceberg is there. Okay, so this is the quality of the iceberg which we can see into our disease concept also, or the concept of causation of disease also, where the majority of the patient who come to us or to a clinician, they only come when they have discomfort. They only come when they have major discomfort or there is a function which normal function that they cannot do, then only they report to the clinician. But the majority of the part, then only we come to know about the disease and we come to know about the burden of the disease. But majority of the part of this particular disease is submerged. That means the clinician don't know that this much amount of disease is there, because the patient do not report with the disease which is unrecognized or the disease which is symptomless, or the milder form of disease where the patient do not find it too important to report to a dentist. Okay, so that much amount of burden of disease is there in community that clinician cannot find out. So we need to concentrate our efforts towards the lower part of the iceberg. So we have to go for a camps as a epidemiologist. We have to go for a camps. We have to find out that unrecognized disease or the milder form of the disease, so that we can stop that process then and there only, and we need not have to make it more worse for that particular patient. So that is the concept of iceberg of disease that we are having. Okay, so with this we're finishing with the concept of causation. From next onwards we'll be learning about the various uh, the healthcare delivery systems of India. Okay, thank you.